different today, so it's not really specifically related to CF, but it is. So what I'm talking about is publishing, and I know you guys publish a lot, but I really like publishing in international journal. I never published in Egypt, so I publish internationally. So I really want that to be more, because that will make more of the awareness of the world. I just got an email a couple of days ago asking what's the situation in Egypt, you know, how many patients, what's the diagnosis, like are you doing newborn screen and all of that stuff. We want to publish all of that instead of people individually asking me questions. So, you know, I'm going to be talking about selecting a research question. The final criteria is really something that we use all the time. I'm involved in the American Thoracic Society does a program for 1 week called MECOR, which is Methods in Epidemiology and Populational Research. I tried to get it to Egypt, but they don't want to go to every country, but it is available in Africa and in Turkey, so if you want to be involved in it. Developing research question, what is research protocol, papers, audience, write journal, all of these things I'll be talking about. So selecting the research question, we have multitudes of research questions. I'm sitting here, I'm listening to all what you're presenting and talking to my colleagues. You know, I can give you like 10, 20 different topics. So you always have to kind of, you know, what we want to do is find something that's important and feasible that you can write about. So for me, it's easy. Like anybody comes to my office in the US and talk to me, I can quickly formulate what we're talking about into either a quality improvement project or a research project, and then we can move on with that. But how about if you're new and young investigator, and you know where to get the ideas? When I started, I got it from my patients. And, you know, I walked into the University of Michigan. I was in another institution. I went in, and the CF patients were not given vitamins. And immediately I'm like, wait, but the other center I came from, all the patients were on vitamins for CF. So that was my second research project that I did, and you know, so it came from my patients. From teaching experience, I'm giving a talk or I'm talking to somebody and a question came in or something like that you can actually formulate. Attending conferences, collaborating with colleagues, looking at your literature, sometimes even looking at the newspaper, you might come up with ideas. We teach that in the MECOR program, in the Methods in Epidemiology and Research, that you always think of anything as a 2x2 table, as we call it, the key to the universe. So anything you are thinking about, you should be able to put it in the 2x2 tables. This is exposure versus disease or outcome. So risk factors versus outcome. Exposure, for example, somebody is smoking, and then the disease is asthma, for example. Smoking, not smoking, so this is really the major, like I said, key to the universe. The next one is the final criteria. So any project or anything I'm thinking about, I talk about the final criteria. Is the good research question, is it feasible? Is it interesting? Is it novel? Is it ethical, or is it relevant? You have to get all of these in your research question to be a good one, and I'm going to elaborate a little bit. So to be feasible, okay, I wanna study asthma, or I wanna study CF in Egypt. I want 500 patients. Is that feasible? Probably not, because not everyone going to agree for you to do the study, and also it's a lot of patients, so it would be difficult to collect data from all of them. So you have to be more reasonable. Also, budgeting is important. Adequate number. That's why we use the power to calculate any the number of patients we need. It is adequate technical. Also, if you're going to have a lot of patients coming, do you have the technical support? Are you having pulmonary function testing? Are you having lab testing? You're going to be able to do all of that. So you always have to think about affordability and your budget that you're going to use. is it interesting? Okay, you know, I have a great idea that I think is great. How about everybody else? Do people think it's great? So is a research question interesting to you? Okay, great. But is it interesting to your peers? So I usually discuss my ideas with my colleagues. At this stage in my career, I can just, you know, if it's interesting to me, probably going to be okay. And then also the funding. You know, are you going to be able to get support to fund what you're studying? I have several things to do. I can do it from the foundation, I can do it from the NIH, I can do it from my own, grants. So, but you have to think about that as well. Is it something new or is it something old? Okay, I'm interested in studying something, but wait, is it something new or I'm just going to repeat something that is already in the literature, then it's not interesting and nobody's going to publish it for me. So good clinical research contribute new information. So again, in Egypt is a you know great opportunity. We have like ways to go and we can publish a lot because it's kind of new here for CF especially. What is new means? Do finding a published study apply to your setting? Find it. Can new technology help you with identifying or modifying your treatment? And it might your study avoid weakness. So there's some problems, and I want to address the problem. So are we going to be able to do that by having this new idea or novel idea? But then, is it ethical? So you have to have your permission from your institution and review board. You have to have the permission from the patients. If it's retrospective study, a lot of the time the institution review board would not make you consent the patients. So that would be a good start. Find out the patient will do retrospective studies, which will be very helpful. Okay, so is it relevant? So I'm doing all of that, okay, but is that worth it? Is it really something that people are going to be interested in, or is it going to change the dynamic of the disease? So with the study findings of advanced scientific knowledge, and influence practice guidelines, influence health policy, or guide future research. So the influence the health policy, the example we use when we teach the course is a study that came from Turkey. In Turkey, they do the genes and they do sand, do something with the sand to make the genes different colors. And then the workers were getting sick. So they did a quality improvement / research project looking at that. And it found out that these sand that the workers are using are causing interstitial lung disease. Then they were able to go to the government and say, okay, here's a study. We prove that it's causing the interstitial lung disease for these people, really sick, getting sick, dying young, and they stopped the practice. So that's a perfect example of working on that. The other example from Egypt is that, okay, we have CF, we know, we've done some studies, you guys done studies as well, and then the Ministry of Health is not aware of anything. It's like, there's no CF in Egypt. So it wasn't until the lobbying started, it wasn't until the papers started being available, then they started providing the crayon, they started working with us to get the Trikafta in the country. So developing a research question, there is always my research question, I'm like, okay, I want to study, now I'm working on studying, CF in Egypt. This is the 100, the 10,000 feet, from the plane, you're looking down, okay, I want to do something. What am I going to do? I'm going to study CF in Egypt to present it in a paper. So, okay, but that's very kind of, vague and it's not very focused. And then you kind of try to work on it to focus it. What am I going to do? I'm going to look at the mutation that I have. I have several, lots actually. And then try to get that, and then try to see if there is any novel mutations that we identified through the work that we did. We want to look at the presentation of the patient. Are the patient presenting similar to what I see in the US? The Partner syndrome or the pseudopartners that you have here, like everywhere, I don't see in the US. So that's kind of interesting to see the difference. So it's not only that you're going to present patients in Egypt, but you're also going to contrast and compare to what we have in the US. And then, you know, looking at, okay, what can we do? And then the other thing is that when I'm doing a paper like this, what is the message I'm giving? I'm giving the message that CF is in Egypt, we have the mutation identified, these are the presentation, but I have to go further than that. I have to give another message. It's like, you know, having studied that, that would help the patients in Egypt, that would help them, like, what is the plan? What did I do with the data? So you really have to focus it, you have to have a plan in your head of what you want to do with your study. It's like, focus it, keep it simple. Don't complicate your life. I work with a lot of students around the world where actually one of the meetings today, virtually and in person, and when we start the course with them, they come up with like huge ideas and they wanted to recruit lots of patients. Our job is to scale it down, make it simple, don't complicate the process too much, and make it feasible in the amount of time that you want to study. You want to study within a certain time, like you want to do a study within 6 months period or a year period. If you do it for longer, you're dragging, and then your data collection is not going to be really as good. So you really make it simple, and you get the message that you need to let people know. So when you're looking at writing a paper, you need to look at the paper, your audience, and the journal. You really don't want to be, I'm going to write the paper, and then I'm going to figure out what journal I'm going to be using, which is kind of like you want to be organized. I love organization, and I love things on time, not procrastinating, like waiting till the last minute. I don't believe in that. My team knows that very well. So before I start writing anything or working on a research idea, I wanna see these questions answered. What do I have to say? Is the paper worth writing? Is it a good idea? Is it already published in format? What is the right format and the message that you're giving? Who are your audience? Are you going to be talking to general pediatrician? Are you going to be talking to a pulmonologist? So that's also very important to keep in mind. And I've submitted papers before to journals, and then the answer that comes back is too specialized. So I have to find another journal. So I've been through this quite a bit as well. And then what the right journal is very important. What do I have to say? What is the message of the paper? And an effective paper deals with an important question. So what is your question? I wrote a paper with Maggie, and about using the laryngeal mask with doing bronchoscopy, and we thought it was a great paper. It was a descriptive paper, and then I ran it by one of my colleagues, and he said, "But what is the message?" Because it was just descriptive. You have to be able to have a message to be able to publish it. And when he said that, it kind of clicked in our head, and we came up with a message. We came up with what we think people like pretend you're talking to someone and trying to win the argument and see what is going on here. And it was published in Pediatric Pulmonologist because we were able to get what he said and able to work with that. In the paper worth writing, before I do anything, we do literature search. Because even if I think I know what's published about the topic, maybe I missed something. And then the reviewers will tell me, oh, you didn't include that, or you didn't include that. So I always have to do literature search. Work with a lot of students, and before you talk to me, just do literature search about this topic. Let's see if you can be able to do it. In the paper's message, new to the literature. If the message is not new, which I've done also, can we have a twist on it? Can we have like something to add to what's published? So that's really important. So even if it is published, but can you look at it differently to be able to, write your paper? What's the right format for the message? So again, before we start the project, first thing I do, I talk to my team and I say who's going to be first author, and I'm going to get to that. Who's second author, who's senior author. Very important to state it before you start, so no confusion. I don't want anybody to be upset. And then I said, okay, we're going to be working with this journal. Let's read the instruction to authors. Let's make sure that the format that we're going to be using is going to be acceptable to them. And a lot of the time, they're especially the ones I work with, it's very similar, but you have to adjust. You have to adjust the length. You have to reformat the references. But very important that you need to read your author's instructions. All author's instructions should be followed closely, not to the T. We just submitted a paper to a journal, and then it was turned to another journal that they can do that. I agreed to it. And then the other journal wanted certain changes in the formatting, and we kept going back and forth to justify for the journal that this is what what they need, because otherwise we won't give it to reviewers. You have to follow all the instructions first before you go to reviewers. And then the reference format is very important. It is different from journal to journal. And then after you write the paper, you should pass it by somebody to read it for you. Somebody that's not your team, somebody outside of your team. So that way they can give you, like we did with the bronchoscopy paper. Who are your audience? Again, is it a general paper for anybody to read, or is it something specific to pediatric pulmonology? The paper I'm writing about CF in Egypt, I know where to submit it. For example, I'm not submitting it to Journal of CF because Journal of CF wanted not. Well, actually, I might, but because they don't like one center study, they want it like generalized. So this is going to be all over Egypt. So actually, Journal of CF would be great because they're interested in international work. If not, I have another journal. So I always have like 2-3 journals in mind. If one journal tells me no, I don't take it personally. I move to the next one because at the end of the day, if the paper is written, it should be published somewhere. This is my message. So we keep working on it till we get somewhere that somebody. One time I submitted the paper to a journal, they tore it apart. They didn't like it. I had like 6 pages of like, we don't like this, we don't like this. I went to another journal with the same thing. I didn't do a single recommendation from that journal. They thought it was a great thing. They accepted it. I'm like, okay. So you never know who would be interested in your work. You have to just keep trying. I usually listen to the reviewer, so I have to look at that. So you need to look and know who are you sending who are you writing for, and when you know who are you writing for, then that will help you figure out the article or the journal that you want to submit to. It's very critical and important early step to know what journal you're submitting to, like I mentioned. And again, before we start, we always have to look at the literature. We have to see, is it something new? It's never been published. Even in the paper I'm writing about CF in Egypt, I have to look at everything that was published before, because I don't want to be, and you give credit to the authors that published that. So you're using it as references, but also you're expanding on it. So that's the goal. Because there is few articles from Cairo University, but it's a single center. There are some articles from Ain Shams, single center, but this one is overall. So you really, that's the beauty of it, is that you're looking at all the country as a whole, most of the country. Again, like I mentioned, authorship, very important to me. I work with a student, she's doing an awesome job. One paper, I told her, you're taking the lead. And when I say you're taking the lead, she is taking the lead. So she developed she worked with me with a questionnaire paper, in Egypt hear about do a physician know in Egypt about CF. So we actually participated with us on it. We sent it to everybody, a questionnaire, and her job was to collect the responses, because sometimes people forget to do it. So she was getting the responses, she collated, she did tables. So she really did a lot of the work. I mean, she's a student, so her writing is not going to be that great. So she wrote whatever she wrote, and then I rewrote the whole thing. That's okay. That's part of teaching. So, but she was the first author for it, and was submitted in the annals of ATS. The scholars of the ATS. So, next paper I'm writing with her, I said, Samya, I'm going to be first author, because I'm leading the process. It was my idea, it's my work, and it's important for me to be first author. A lot of the time, it's not. I'd rather be last author. Senior author is also a very good way for senior people. But it's important to identify. So not halfway through writing, somebody comes and say, "Well, I should be part of the study." Well, you have to be from the beginning. Review criteria for authorships in the journals. Like, a journal now asking what is the role of each person in the team. So I have the paper about Egypt, I have 16 people, maybe even more, authors. Never ever had anything like that before. But I have to say what they did, and a lot of them gave me data, a lot of them worked with me in collecting data. So that's important to let the journals know. And then assemble research data, case reports, records, tables. You prepare everything, then you start writing. So I know what first table is going to be, what second table is going to be. I know there will be figures. So all of that is, and I'm now confirming with the geneticists that we're using the data that we have. Just, I think that getting to a little bit of examples here. So, publishing global CF projects in general, there are limited data about CF care from low middle income countries specifically, which is great. That means we can publish. That's always a good thing. Global, there is a lot of global interest in CF right now. So, wherever meeting, I'm going to be presenting in the North American CF meeting about the work in Egypt, about TRICAPTCHA, so I'm going to be collecting data as we go. So it's really good that people were not interested like 20 years ago, people were not interested 10 years ago. Now they all are, because they're seeing CF patients are doing so much better in the high income countries, and now people are saying, wait, but the CF kids in the low-income countries, they need to do better. So there's a lot of interest, so that's great. Let's create publications. When working collaboratively between centers there is a work between high-income countries and low-middle-income countries, like what we're doing now and what we did with Turkey. This is a very good example. I presented my Turkey experience in the European CF meeting maybe 4 years ago, and they were very interested in knowing the details, because what they created from our experience in Turkey is something called twinning. Twinning is like you twin a high-income country with low-middle-income country in Turkey, and they've been doing that and built on our example of the Turkish work that we did with the University of Michigan. And the reason they knew about it is, yes, everybody told them, but it was published as well. So publication is your way for people to know what you're doing. So examples, again, in Turkey, we presented a lot of what we're doing, like we're presenting here. Their status was a little higher than here. So, they already have centers, they already have trained people, but their data was not very good, and they didn't have enough support. So, we presented depression and anxiety screening for them because they kept asking for it. They didn't have psychologists, they don't have social worker, they have psychiatrists. But anyway, they took the questionnaire and they translated it to Turkish, and they did screening for depression and anxiety. They were able to publish it. And then, they used, as Sharon showed you, the technique for the yearly evaluation for equipment and cleaning equipment. They took that and they did it and published the paper there as well. So, this is the thing. The thing is that we need to work on that. And then and that's actually published since then. They did the quality improvement project on the FEV1 and on the BMI, and the improvement in data was fascinating to me, actually, and to everybody. Mm-hmm. And that's been published in pediatric pulmonology. So there was a paper I published, and that's how they knew about the collaboration. And this paper was mainly a structure paper, so it wasn't a data-driven paper. It was mainly telling people how to, the collaboration and how to start it and what we ended up with. So I ended up describing what we've done to collaborate with Turkey, what the result of that, how much improvement data has been happening there. So, and that was published. And again, when you publish, people know that you are working on it. So not just by saying it. This is from Egypt. So we did several, actually every year I send abstracts, and every year the abstracts are accepted because people are really interested. So this one was done just talking about the global care in Egypt from zero to manage. I mean, we started from zero. Like 20 years ago, there was no CF in Egypt. And nobody really acknowledged it. And then we started, and gradually we got there. So that was kind of a journey of what we've been through at that time. And then this one also talking about the contribution of collaboration between Turkey and Egypt. And I usually put all the names of the authors. The previous one I didn't because it was descriptive with me. Yeah, okay. And then Turkish as Egyptians love pictures. The third picture in the North American CF. So, okay, sometimes I'm writing and sometimes I get stuck. I'm not focusing. I kind of like, they call it the writer's block. Okay, I've been working on the paper, and all of a sudden, I'm pushing myself, but I'm not there yet. It's fine, it's okay, take a break. Do something else and then come back to it. So right now I'm like quarter of the way for the Egyptian paper, and there is another paper we're going to be doing, and I'm here, so I'm not writer's block but time block. So when I go back, I'll do it. And then also because of the publications that we do, and because the people hear about what we're doing and excited, pediatric pulmonologist is going to accept a proposal from me and Bülent and Yasemin from Turkey to do a special issue for pediatric pulmonology. The whole issue we're controlling. We're invited the authors. I'm going to be writing a paper about roadmap to global care, which will be, I think it's going to be great, right? So it's going to be really interesting to, we're inviting top people in the world to write in that journal, in that thing. And why did they accept our proposal? I mean, because they know we're working on it, we know that we get things done, we know that we published. My funny story is that I got one of the thesis from Ain Shams. They said, here, take that, and the PhD thesis, and can we write it in a journal, international journal, and I worked on it. This one I worked a lot on because the formatting is different. Yes, they are writing in English, but the English is different. So I worked on it so much, submitted to pediatric pulmonologists, and I got 7 back and forth, 7 times. It's usually 1, 2, and we're done. 7 times to the point I'm like, what's going on here? But it got published. So you have to be patient with it. You have to keep working on it till it happens. And now they know about the liver disease in Egypt and how different it is from the US. So in summary, steps in planning, and this is really important. You really need to remember these. Is that you need to know what the message of the paper is. You need to know what you're writing about. Focus. Whether the paper is worth writing, in the importance of the paper, the audience of the paper, and the selection of the journal. You need to, before you start, so okay, have an idea, but is that a good idea? Look at the literature. And then if it is reported in the literature, see how you can modify it to make it more interesting. Have like like maybe when you read the articles in the literature, you can see there is a little bit of a deficiency that you can focus on. Decide on the authorship, assemble the material needed to write, look up the manuscript's requirement in the journal, consider paper proper structure, like sometimes they wanted introduction, sometimes they wanted background, so it's important to the journal you have to follow. Consider the paper proper structure. Revise for fluency, so if, like I mentioned, the liver, the CF liver disease, they wrote it in English, but it has to be rewritten in English. So just nothing against them, but the way it is. Revise the first draft and subsequent drafts. So usually I do the first draft, I run it by all the authors if I'm writing it, and then we revise it as well. Sometimes it might be 6 revisions before it sees the light and goes to the journal. Make sure details of the scientific styles are correct. Prepare the tables, and that's really important. The tables and the figures should follow what the journal is telling you, because that was a problem with the CF liver disease, that the tables they send me with different formatting than what the journal is required, so it has to be redone. Review and revise. And then assemble, copies, and all authors should review and approve, and respond to the editor's decision and reviewer. I usually do literally everything the reviewers tell me. If I have a problem with what they're saying or disagree, I will discuss why. It's not correct, or they don't know the population. It's really important to address every point of the review. And if approved, there's always the proofs that you get, and they always give you, like 2 days to do it. Okay, well, I'm traveling, I cannot do it in 2 days. I usually contact the journal, I said, I'm sorry, I'm behind, I'm out of the country or I'm out of town, can you give me extension? They can. But usually I follow that. I know when the proofs come in, it's 2 days, immediately I work on it. This is one of the references that we use. So that's a very good reference, and then from what I do as well. And thank you. Any questions?
Thank you, Dr. Samya. I think that for me this is like a super interesting topic. One of the challenges that may present a quality improvement project is how to make time for us here to think about research and publication. Because I think one of our biggest challenges doing work at Abolish, and I'm not generalizing other universities, is that we are completely overwhelmed with clinical and undergraduate teaching and exams and all of this, that we really don't have enough time to think about the papers.
Right, and I'm very familiar. Remember I told you before that the only way for you to publish with me is to come to the US.
I have now time to do that.
Well, you've done it twice, so that you did my duty, you did your duty. But yeah, so I do a lot of work at home after work, but you have clinics here. I don't have clinics. I do my work during the day. I'm supposedly done by 5 or 6, but I work longer and I work weekends. So a lot of the time, especially junior faculty, I'm expecting them to work more. Sometimes you give them protected time, a lot of the time they don't have that. So, to start, to get your career going, you really have to be able to put the time into it. You're already a professor, it's good for you to publish because it helps in Egypt in general, but you can be the senior person, the senior author to help them out. But the junior faculty, I really think they need to put time into it. and maybe the junior faculty don't have clinics yet, so, but they have to be willing to do that.
Another challenge for them would be that they have young families
Yes.
with young children who are also very demanding in terms of time. So,
No, I understand all that. I mean, I'm not here, so I kind of understand, not fully. But I did it with my children young. I mean, I would sit with them, they're doing their homework, I'm working on my papers. So, and that's in the US, so I'm sure here it's more difficult, but if there is a will, there is a way. So, and that's the only way. I can help somewhat, but I'm not, I tried that in ancient. I would not take another thesis to redo because it took like 6 months of my life to get it together. But yeah, I mean, it's difficult. I know there is the structure is different, the culture is different, but to move on and to write internationally really is important to be able to get your word out there. And then if there is a question, I'd be happy to help. If there is anything, any idea that you want to run by me before, if it works right or whatever, I'll be happy to help with that. But it's, right now, for me, I don't need to write. I'm okay. I'm promoted and I don't really need more publications. So I like to do it. So I usually just sit down on weekends and holidays and I just do it. Unless my kids are visiting, then I don't do that. So, yeah.
Any questions for Samya?
Questionnaires? Good morning, everyone. Questionnaires and surveys usually have a reputation amongst us in publishing. Is that true or not? This is my first question. The second is the experience that is stated about the article that you gave to one journal, they disliked it, and then the other one was overwhelmed about it. So judging articles, is it a subjective process or is there a framework that reviewers use to judge articles? Last thing, how to use AI. How to use AI tools.
Oh, okay.
How to put that.
All right. So the first question for the questionnaires, I've done questionnaire studies. You don't start by developing your own questionnaires. You find a questionnaire that's already published. If you're going to translate it because it's in English, you need to translate it and then back translate it to English to make sure it's the value, the gist of it is still there, and then you translate it into Arabic. So this is if you're gonna it's easier to just find a questionnaire translated into Arabic that's strictly to politics. But I published articles using questionnaires. But the idea is yes, sometimes it's more difficult to do it. But again, you start with a good question, you get a good survey, questionnaire, and then you use it, and then you show the difference, and that you should be able to publish that. The second question.
Judging articles.
Right. So I'm one of the associate editors for pediatric pulmonology. So I send articles to people to review all the time. They review according. So I choose according to their experience. Like, are they experienced in that topic? Are they been published in that topic or not? If I send it to somebody that didn't have enough experience, we usually have the ethics to say I'm not going to do it because it's not really my area of expertise. There is no guidelines. There is no list of things. I mean, there are people that publish and there are people that are known. So there is no guidelines for them. So that's what I mentioned. Usually when I get a paper submitted to a journal and they didn't like it, but the reviewers said, you need to fix this, and that, I do it. So I just, do listen to them, and then if they don't accept it to that journal, I send it to another journal that makes the paper stronger. But that specific example, the reviewers, I didn't agree with them, and there was lots of things that they requested, and I just was like, I'm just going to submit it to another international journal, and they accepted it. So that's not usually you work harder on that. But generally there is no guidelines specifically to the reviewer. But it's people that you know that they're in the field. AI is a new field in town. That's you young people going to tell me. I have not used it. My grandchildren, my little ones, are using AI. The 8-year-old, are using it. I'm like, I have no idea. So they are teaching me. So I haven't used AI yet. But if you use AI, you have to acknowledge that I use AI, or and modify what AI said or something like that.
Thank you, Dr. Samya. And now Sarah Yahya, an assistant professor from our department, will present an interesting case from our department.
So I'll be presenting the case admitted at our unit, Ahmed Ahmed. He's a 2-year-old male patient, third sibling of consanguineous marriage. There was history of NICU admission for 3 days due to jaundice. And then, at the age of 2 months, he was admitted at PICU due to pneumonia. He was admitted there for 1 week, and then there was another hospital admission at the age of 2 years for 25 days due to pneumonia. And then he was discharged. The condition recurred several times with several admissions due to pneumonia. And again, he was last December, and he presented to the ER with RD2, diminished air entry on the right side. His CT chest showed massive right consolidation with mild left consolidation, and he was also admitted to the PICU for 19 days on high flow oxygen, and he was gradually weaned. During this period, CT chest was done, which showed right lung near total ground glass attenuation with thickening of interlocular septum, giving crazy teasing appearance. With relative sparing of the medial segment of the middle lobe, apical and anterior segments of the upper lobe. So bilateral pulmonary ground glass bleeding appeared in his CT chest, and he was suspected to have pulmonary alveolar proteinosis. So he was scheduled for bronchoscopy, where bronchoalveolar lavage was done, and a PAM stain was done, and the VAM cytology showed a picture compatible with alveolar proteinosis. The patient was admitted on antibiotics, and he improved and was discharged. But since then, there were several admissions. The last one was 10 days ago. The patient presented with high-grade fever, 39 degrees, respiratory distress, and he was admitted again at our unit on nasal oxygen. A month ago, he had a whole lung lavage, which was done with the cardiothoracic team. It was scheduled every time his condition worsened. So he was admitted on Tavanic Dalicin for about 10 days till now. His morning gastric aspirate was done, but the results were mixed respiratory flora, so it was done again today. The patient is still feverish, 39 degrees. So today we will shift his antibiotics to vancomycin and Varimin. CT chest was done again, and used CT chest during this admission. It showed bilateral lower right middle and right upper posterior segmental asymmetrical opacities and coalescing consolidations, bilateral lower lobe interlobular and intralobular septal thickening with ground glass opacifications. His labs showed he was admitted with a CRP of 112. It started rising to 178. Also, the TLC count started rising to 22. That's why we changed the antibiotics to vancomycin